What if the very pill you trust to protect your heart is quietly sending your body warning signals you've been ignoring?
Millions of people take blood pressure medications like Amlodipine, Losartan, and Lisinopril every single day, believing they fully understand them. But the truth is, many dangerous side effects don't feel dramatic at first. They can look like simple fatigue, dizziness, swollen ankles, poor sleep, weakness, or just getting older. And that's exactly why this conversation matters. Most people are not harmed because the medication was prescribed incorrectly. They get into trouble because nobody fully explained what these medications can actually feel like inside a real body, living a real life. The early warning signs are often subtle, confusing, and easy to dismiss until they suddenly become impossible to ignore. Welcome to Dr. Healthy Hub, the channel dedicated to helping you understand your body, your medications, and the health truths that could protect you or someone you love. If you're taking Amlodipine, Losartan, or Lisinopril for high blood pressure, there are several critical things you deserve to know. Not because anyone is hiding information from you, but because most medical appointments move too quickly, and many people leave with a prescription long before they truly understand what to watch for. In this video, you'll discover which side effects are common, which warning signs should never be ignored, and why some symptoms that seem harmless can actually...
Let's start with Gloria, because her story explains exactly why this conversation matters. Gloria was organized, disciplined, and careful with her health. She took her medication exactly as prescribed, kept every follow-up appointment, and rarely missed a dose. On paper, everything looked excellent. Her blood pressure improved beautifully. But after a while, she noticed something strange. Her shoes no longer fit comfortably. By evening, her ankles looked swollen and heavy. She assumed she was gaining weight. Her daughter worried it might be a heart problem. Gloria became frightened. What nobody had clearly explained to her was that the same medication helping her blood pressure could also cause a specific side effect that often confuses people into thinking something else is wrong. One of the biggest misunderstandings about blood pressure medication is assuming all of these drugs work the same way. They don't. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. They all lower blood pressure, but they do it through completely different mechanisms, which means they can produce very different side effects.
Understanding that difference matters more than most people realize. Amlodipine commonly causes swelling in the lower legs and ankles because it relaxes blood vessels in a way that allows fluid to collect in the tissues. Lisinopril is known for causing a dry, persistent cough. Losartan is often prescribed when someone cannot tolerate that cough. Same goal, different pathway. Different warning signs. If someone develops a cough while taking Lisinopril and assumes all blood pressure medications will cause the same problem, they may stop treatment entirely. If someone experiences swelling on Amlodipine and assumes it means heart failure, panic can set in unnecessarily. And if someone feels perfectly fine on Losartan and assumes there's nothing to monitor, they may miss important changes happening silently in the background. The name on the bottle matters because the medication class often predicts the pattern of side effects. Once you understand that pattern, you're less likely to be caught off guard by what your body is trying to tell you.
One of the most misunderstood side effects is swelling caused by amlodipine. People often blame salt intake, aging, lack of activity, kidney problems, or weight gain. But with amlodipine, the swelling usually happens because the small arteries relax more than the veins do. Blood enters the legs easily, but doesn't return upward as efficiently. Pressure builds in the tiny vessels, allowing fluid to leak into the tissues around the ankles and feet. Many people notice that their legs look normal earlier in the day, but become swollen by evening. Sock marks become more noticeable. Shoes feel tighter. The legs may feel heavy or uncomfortable. Arthur experienced this without realizing the connection.
every afternoon his ankles became more swollen than they were earlier in the day. He assumed it was simply part of aging. He even started elevating his legs at night and noticed the swelling improve temporarily, only to return later. He never connected the problem to the medication he had recently started. What made the situation worse was the silence around it. He didn't want to bother anyone, so he kept taking the medication while becoming increasingly uncomfortable. Eventually, he began skipping doses whenever he planned to go out because he felt embarrassed by the appearance of his legs. That's how a manageable side effect can slowly turn into uncontrolled blood pressure.
Another side effect many people ignore for too long is the dry cough linked to lisinopril. What surprises many patients is that the cough does not always begin immediately. Sometimes it appears days later, sometimes weeks. In some cases, it may take months before the connection becomes obvious. Because of that delay, people often blame allergies, dust, reflux, dry air, or a lingering cold. The cough is usually dry, irritating, persistent, and exhausting rather than dramatic. It tends to worsen at night, making sleep difficult and leaving people drained during the day. Helen experienced exactly this. She developed a constant tickle in her throat and nighttime coughing that wouldn't go away. She tried cough drops, changed household products, and even replaced the air filter in her home. Nothing helped because the real cause was sitting quietly in her pill organizer all along. Once the connection was explained, everything finally made sense. This matters because many people silently struggle with this cough for months before eventually stopping the medication on their own without discussing it. But there's an even more important warning people need to understand.
A dry cough from lisinopril is usually not a dangerous emergency. However, swelling of the lips, tongue, face, or throat is completely different. If swelling makes it hard to breathe or swallow, that is not something to ignore or wait and see. That situation requires immediate emergency medical attention. ACE inhibitors like lisinopril can, in rare cases, cause a condition called angioedema, which can become life-threatening very quickly. ARBs such as losartan have also been linked to rare cases of swelling, but the classic concern is usually associated with ACE inhibitors. So if you hear about a dry cough, there's no reason to panic. But if you notice swelling of the tongue, throat, lips, or face, especially if breathing or swallowing becomes difficult, that is a completely different situation and requires immediate medical attention. One of the most dangerous truths about these medications hides in plain sight at the grocery store. If you take losartan or losartan, potassium matters. Many people assume they are safe because they don't take potassium supplements, but potassium is found in far more places than people realize. It appears in salt substitutes, heart-healthy seasoning blends, electrolyte powders, meal replacement drinks, and many over-the-counter products people use every day without thinking twice. Both losartan and losartan can raise potassium levels. When potassium becomes too high, it can interfere with the electrical rhythm of the heart. The warning signs may begin quietly, showing up as weakness, fatigue, tingling, muscle cramps, heart palpitations, or sometimes almost no symptoms at all.
Robert learned this the hard way. He was trying to improve his health by reducing sodium and reading food labels carefully. He proudly switched to a salt substitute, believing he was making a heart-smart decision. What he didn't realize was that many salt substitutes replace sodium with potassium. So while taking losartan, which can already increase potassium levels, he was unknowingly adding extra potassium to nearly every meal. Eventually, he started feeling weak and noticed occasional skipped heartbeats. By the time his blood work was checked, his potassium levels had risen high enough to require urgent medical attention. The heartbreaking part is that Robert wasn't careless. He was trying to do everything right. Nobody had connected the dots for him. Another area that confuses many people involves kidney function tests. Losartan and lisinopril are not just blood pressure medications. In the right person, they can also help protect the kidneys and heart over time. But after starting these medications or increasing the dose,
blood tests may show small changes in kidney numbers, such as a rise in creatinine or a drop in eGFR. To many people, that immediately sounds like proof the medication is damaging the kidneys. Sometimes it can signal a problem, but in many cases, a mild early change is expected because these medications alter pressure inside the kidney's filtering system. That's why monitoring matters so much. Looking at one number without context can lead to unnecessary fear.
Sharon nearly made that mistake. She had high blood pressure along with early kidney disease and was prescribed lisinopril partly because of its protective benefits. After reviewing her lab results online, she noticed slight changes and became convinced the medication was harming her kidneys. She was ready to stop taking it immediately. What she needed to understand was that the important question wasn't simply whether the numbers changed. The important questions were how much they changed, whether the trend was stable, and what else was happening in the body at the same time. A mild, monitored change can be very different from a dangerous decline. That's why follow-up blood work is not optional. It's part of the treatment itself. This leads directly to another major issue many people never hear enough about. Dehydration changes everything. If you take losartan or lisinopril and then develop vomiting, diarrhea, heavy sweating, poor appetite, or a stomach illness, the medication that worked perfectly under normal conditions may suddenly affect you very differently.
Blood pressure can drop too low. The kidneys can become stressed. Weakness, dizziness, or fainting can appear much faster than expected. The medication itself did not suddenly become dangerous. The body's fluid balance changed, and now the same dose is acting inside a completely different environment. Frank experienced this during a severe stomach illness. Even though he could barely keep fluids down, he continued taking his usual medication because he believed missing doses was always wrong. Later that day, he stood up and nearly collapsed from dizziness. In the emergency department, the problem wasn't that losartan was a bad medication. The problem was that his body had become severely dehydrated, causing his blood pressure to fall dangerously low while placing stress on the kidneys. What he really needed was guidance about sick day situations and when illness temporarily changes the rules. Another hidden danger sits in millions of medicine cabinets and often goes unnoticed because it involves over-the-counter pain relievers. Medications like ibuprofen and naproxen may seem harmless, especially when used for arthritis, back pain, or sore joints. But if someone is already taking lisinopril or losartan, especially alongside a diuretic or water pill, regular use of these anti-inflammatory medications can place significant stress on the kidneys.
This combination catches many people off guard because each piece seems ordinary on its own. A blood pressure medication, a pain reliever, maybe a water pill. Nothing sounds alarming individually. But together, especially during dehydration or illness, they can reduce blood flow to the kidneys and increase the risk of kidney injury. Carol discovered this after using ibuprofen regularly for arthritis while taking lisinopril and a diuretic. Her blood pressure became unstable and her lab tests worsened. Eventually, the interaction between the medications became clear. Once the anti-inflammatory medication was reduced and safer alternatives were reviewed, her condition improved. Many people think medication dangers only come from rare side effects hidden in fine print. In reality, some of the biggest risks come from common medication combinations that are never discussed carefully enough. Another side effect people normalize far too easily is dizziness. Lightheadedness, weakness when standing up, or that spinning sensation after getting out of bed can happen when starting these medications or increasing the dose. The body sometimes needs time to adjust to lower blood pressure. People often brush it off by saying they stood up too quickly. But in older adults, a few seconds of dizziness can lead to dangerous falls, broken bones, or serious injuries. Sometimes dizziness means the medication is lowering blood pressure too aggressively for the body's current condition, hydration level, or medication combination.
He had been told the medication could lower his blood pressure, but nobody had explained what that might actually feel like in everyday life. Standing up in the middle of the night, walking through a dark hallway, or moving too quickly after getting out of bed. That is the difference between simply prescribing a medication and truly preparing someone for it. Mild dizziness may improve as the body adjusts, but fainting should never be ignored, and repeated dizziness is not something people should silently tolerate. Another major mistake many intelligent people make is judging their medication based on a single blood pressure reading. They see one high number and immediately assume the medication has failed, or they see one low number and decide the medication is too strong. That's not how blood pressure works. Blood pressure naturally changes throughout the day. Sleep, stress, pain, posture, meals, caffeine, anxiety, and even worrying about the reading itself can all affect the numbers. A single reading is only a snapshot, not a final verdict.
What matters most is the overall pattern over time. Diane learned this after constantly checking her blood pressure whenever she felt anxious or stressed. One high reading would trigger another check, then another, until she had pages of numbers and growing fear that her medication wasn't working. But once she started measuring under calmer, more consistent conditions, resting quietly and checking at the same times each day, a very different picture appeared. Her medication was actually working reasonably well. The problem wasn't the treatment. The problem was the chaotic way the readings were being interpreted. This matters because once people believe their medication has failed, they often begin making impulsive decisions. They skip doses, take extra pills, or demand medication changes based on panic instead of patterns. Good medication combined with poor interpretation can still lead to bad outcomes. Another issue that creates unnecessary problems is inconsistent timing. These medications work best when they are taken consistently. Same routine, same general time, same system every day. If a dose is missed, doubling the next dose is usually not recommended unless a healthcare professional specifically advises it. Most instructions recommend taking the missed dose when remembered, unless it is already close to the next scheduled dose. In that case, the safer approach is usually to skip the missed dose and continue the normal schedule. Yet many people double up because they become frightened by the idea of their blood pressure rising. That fear can lead to dizziness, weakness, or blood pressure dropping too low.
Consistency may sound simple, but it is what turns a prescription into a stable, long-term treatment instead of a daily guessing game. Martin struggled with this constantly. If he forgot his medication in the morning, he would take it later. Sometimes he would convince himself to take an extra tablet just to be safe, especially after seeing a high reading at home. One evening, after worrying about a high number, he took an extra dose because he feared having a stroke overnight. The next day, he felt weak, shaky, and unsteady. The problem wasn't recklessness. The problem was misunderstanding how these medications work. Blood pressure medications are not rescue pills for random spikes. They are long-term treatments designed to work through steady, consistent use, not emotional reactions to isolated numbers. And this leads to the most important truth of all. The best blood pressure medication is not simply the one that creates the lowest numbers for a few weeks. The best medication is the one a person can take safely, consistently, and comfortably over the long term because it fits their body, symptoms, lifestyle, lab results, and overall health. That's the part many people miss. A medication can look perfect on paper while quietly failing in real life because the person hates the side effects, doesn't understand the warning signs, or has slowly started avoiding the medication altogether. Amlodipine may control blood pressure beautifully for one.
Teresa's story brings all of these issues together. Her blood pressure readings looked excellent while taking lisinopril. On paper, everything appeared successful. But every night she coughed constantly, slept poorly, and slowly began dreading the medication.
she stayed silent because she assumed she would simply be told to live with it. That silence became the real danger. People often begin by resenting the medication. Then they start missing doses intentionally. Eventually, they stop taking it altogether, and their blood pressure rises again. What Teresa needed was not a lecture. She needed a treatment plan that actually fit her body and daily life. Once the cough was recognized as medication-related, adjustments could finally be made. That is what good care looks like. Side effects are not weakness. They are information. Swelling is information. Persistent coughing is information. Dizziness is information. Muscle cramps, weakness after dehydration, unusual fatigue, palpitations, or ongoing lightheadedness are all signals that deserve attention. The goal is not to diagnose yourself. The goal is to notice patterns and speak up early. Too many people believe being a good patient means never complaining. In reality, a good patient pays attention, reports changes early, and does not wait until symptoms become dangerous. Silence is not strength when it comes to medications. Silence increases risk.
Here is the practical framework to remember with these medications. If you take amlodipine, watch for ankle swelling, flushing, headaches, dizziness, or heavy legs by evening. If you take lisinopril, watch for a persistent dry cough, dizziness, or any swelling involving the lips, tongue, face, or throat. If you take losartan, pay attention to dizziness, dehydration during illness, weakness, muscle cramps, tingling sensations, or irregular heartbeats that could suggest potassium changes. With losartan and lisinopril especially, regular blood tests matter. With all three medications, consistency matters. And with every medication, unexplained symptoms deserve attention. You do not need absolute certainty before contacting a healthcare professional. A concerning pattern is enough reason to ask questions. It's also important to remember that not every side effect means disaster. Some mild symptoms improve as the body adapts. Mild headaches or temporary dizziness may settle over time. A dry cough may be irritating without being immediately dangerous. But there is a difference between a symptom that improves after a short adjustment period and a symptom that continues damaging quality of life. Many people either panic over manageable symptoms or ignore serious ones for too long. The goal is neither panic nor denial. The goal is understanding. Once people understand how these medications work, much of the fear disappears. They stop assuming every symptom means catastrophe, but they also stop pretending important warning signs mean nothing. That balance is where real safety exists.
Many people take blood pressure medication while living in a fog of partial understanding. They know the medication name and the dose, but they don't understand why their ankles swell, why a cough develops, why dehydration suddenly matters, why blood tests are necessary, or why something as simple as a salt substitute can become risky. That confusion creates fear, and fear often leads to poor decisions. But when people understand the mechanisms behind these medications, they become far more confident and far safer because they stop being passive with powerful treatments. If this information helped you, consider sharing it with someone who takes blood pressure medication. There's a good chance they may need to hear it too. And stay tuned for the next video, where we'll continue breaking down important health topics in a way that's practical, clear, and easy to understand before small warning signs turn into bigger problems.